Hello, I'm Dr. Rohini. Today I'm going to talk to you about hypothyroidism and how is it going to affect your fertility. So let me start with the basic physiology how thyroid hormone is released in our body. So thyroid hormone is released to a gland called thyroid gland. This thyroid gland is usually present in the neck, and what basically happens is from the brain there is a hormone release which is called thyroid stimulating hormone, that is TSH. This hormone is released from the brain, and it stimulates or activates the thyroid gland, which releases the active hormones T3 and T4, that is thyroxine hormone. Whenever the level of hormones are reduced, so automatically the body sends a feedback to the brain, and the level of TSH, that is thyroid stimulating hormone, is increased. So this is how thyroid gland functions. Now, what are the clinical features, that is signs and symptoms, when the thyroid levels are reduced in our body? So whenever hormones are released, the basal metabolic rate reduces. Because of this, there may be few changes in our body, like the heart rate will reduce, and the person may feel intolerance to cold. There may be weight gain, and some other features like loss of hair and excessive sleep. These are some of the common features of hypothyroidism. Now, next, how is thyroid test done, and what do we look for? So thyroid test, basically we look for three components: TSH, T3 and T4. So as far as hypothyroidism is concerned, to judge that we see only TSH levels. That gives us an idea whether thyroid is under control or not. Now, when should the test be done? So the test can be done at any point of the day. Earlier, testing was done on an empty stomach, but now according to recent evidence, you can do your thyroid testing at any point of the day, and you need not be fasting for that. Now, what is the normal values? So thyroid TSH levels should be less than 5. If it is more than 5, then we take it as hypothyroidism. Now, next, how does hypothyroidism affect fertility? So, whenever thyroid levels are reduced or TSH is increased in case of hypothyroidism, in that case, what happens is it prevents the egg from being released in the ovary every month. So, it causes anovulation basically. And then, apart from that, it reduces the quality of the egg which is released. It causes some menstrual abnormalities, that is, your periods will not be proper, they will not be regular. And it also affects another hormone which we call as prolactin, that is the milk hormone. Because of less thyroid levels, the prolactin hormone will increase, and the patient may experience again irregular periods. There may be milky discharge from the breast, and this hyperprolactinemia situation also prevents the egg from being released regularly from the ovary, and also affects the egg quality. So this is how it affects fertility. What is the cutoff for patients who are trying to get pregnant as far as TSH hormone is concerned? So when a patient is trying to get pregnant, as per evidence, it's ideal that the thyroid levels, that is TSH levels, should be less than 2.5. As far as normal other individuals are concerned, less than 5 is enough. But if you're trying for fertility, less than 2.5 would be ideal. How to treat hypothyroidism? So now next you are diagnosed with hypothyroid. So next we would be starting you on some tablets, that is will be supplements for thyroid hormones. They are available thyroxine hormone. They are available by various brand names like Thyronorm, L-Troxin, but basic formulas they'll be thyroxine replacement. So now this tablet has to be taken every day, empty stomach, in the morning. And once that you start your thyroid tablets, it's not enough that you just start taking the tablets and that's it, the treatment is done. No, it's important that we taper, increase or reduce the dosage based on a repeat thyroid testing, which is ideally done after 6 weeks of the first test. So once you get an abnormal test result, we will start you on medications, and then after 6 weeks again we would be repeating the test to see whether the values are appropriate or not. So this was a brief overview about hypothyroidism. In our next session, I will talk to you about what happens when the thyroid level increases in the body, that is hyperthyroidism.